apologizing, my camera is not working, but I am here with you through via voice means. Thank you for joining us. We are excited to be with you and to share some information as it pertains to the VA, some resources, access to care, etc. My name is Suzanne Buemi, and I am the Joining Community Forces Liaison and the Interim State Family Program Director for the Colorado National Guard. I've been with VCP for a couple of years now. I have enjoyed the partnership and the networking, and I really look forward to working with all of you today and presenting some helpful information. Please don't hesitate, should you have any questions, to ask them. You can do so through the chat bar, or you're welcome to ask the questions as we move along. We want to make sure that your questions get answered and attention is brought to them. I'm going to allow Bryan and I'm going to ask Bryan and Bethany to share a little bit more about themselves.
Thanks, Suzanne. Glad to see so many people here today. So my name is Bryan Stice. I'm a psychologist. I work in the VA Eastern Colorado healthcare system out of the Denver metro area. Part of my role in my position is I am the community liaison for non-VA organizations representing our mental health service here. So that's what I'll be speaking to today, is how to better connect with our mental health services. And just to know that I'm certainly available for additional consultation down the road if anybody has any further questions. Glad to be here. Beth?
Good morning, all. So my name is Beth Bernard, and I am a PACT social worker at the VA, which stands for a Patient Aligned Care Team social worker. I have been in my role for about a year and a half and just really have a passion for sharing more about the VA and being transparent about what we can provide to folks and try to make us as accessible as possible. Given the large group, we might just have folks put in their questions in the chat box that we'll be monitoring. It's so great to see. I think we have over 100 people this morning. So thanks for everyone who shared where you're coming from and your role. We're looking forward to talking with you this morning. So Suzanne, you want to take it away?
Great, thank you, yes. Okay, so today, just as we talk with you guys and share a little bit more information about our presentation and why we're here, we're going to identify how folks can enroll in the VA and recognize the differences that are between the VA Health Administration, the benefits section, as well as the National Cemetery. We're going to describe the VA Geriatrics care system and talk a little bit more about that. We're going to identify opportunities for case management, what case management looks like, and I'll obviously talk about some mental health services and where you can go to access that care. Next slide. Very good. So as we see here, Colorado has over 403,000 veterans. It is really important to us as a collective whole to be sure that we are providing the best level of care that we can to them, and how do we do that, right? So wanted to give you a screenshot as to who we serve and where most clinics are located outside of our Denver metro area. Next slide. And at this point, I will turn it over to Bethany.
Okay, great. Thank you, Suzanne. So I like to start out by just kind of going over the different branches we have here through the Department of Veteran Affairs. I think sometimes it's hard, even as a provider, to distinguish what benefits fall under what part of the VA. And so if you see here on the left-hand side, we're looking at the Veteran Healthcare Administration. And that is where myself and Bryan fall. So we're working in the healthcare system, providing direct care to veterans. As a social worker in primary care, I kind of do a dance between these other two parts of the VA because a lot of our questions come about what benefits veterans are eligible for. So a lot of the times we're referring out to a veteran service officer or an agency that can help veterans apply for these benefits. And then it also, veterans go through what's called a compensation and pension evaluation if they're filing a disability claim, and that falls under the VBA as well. And then the third part of the Department of Veterans Affairs is the National Cemetery Association. And so that is where we direct veterans to for burial benefits, memorial items, that type of thing. So common question we get, and if you're a direct service provider working with a veteran who tells you that they've never gotten connected with the VA, the first thing they'll need to do is apply and see if they're eligible for benefits. So even with COVID, veterans can come in person to our facility, the Rocky Mountain Regional VA off of 1700 North Wheeling Street in Aurora. We request that they bring their DD-214, which is essentially just discharge paperwork that shows that they were honorably discharged. For the most part, a veteran has to be honorably discharged to access our services. There are some exceptions. And then we want them to have a photo ID. We are offering people to enroll online, so that is definitely an option for folks if they don't want to come into our facility. And then something that we're going to ask of them when they do enroll is for their income information, and then we also ask for any prior year's non-reimbursed medical expenses, any vocational or educational expenses, and funeral or burial expenses. And that's an important number because whatever they spent on those expenses gets deducted from their overall income, and then that determines their eligibility. So it is important that we get accurate numbers when they're enrolling. Another common question we get is, well, what if they don't have their DD-214? So the most common way to get that form is through requesting it through the National Archives. And you can just go on that website, print out a form, fax, mail it in, and then they will get back to you. There are a couple newer websites that veterans can also use to request service records that are listed here. But oftentimes for our older veterans especially, it's just easier to use a paper form. And then throughout this presentation, I'm going to highlight that it's always okay to refer to a veteran service officer if you don't know the answer. So I like to refer to these folks as the gurus of VA benefits. They're a free resource for veterans, and they're really there to make their lives easier. And so at the end of the presentation, I will share that resource. I'm also going to be sending out these slides and some helpful handouts that I encourage you to share with your clients. So we throw this term around a lot. We'll always ask you when you give us a call, is the veteran service connected? And so what exactly does that mean? Well, if a veteran chooses to file a disability claim after they've separated from the service, they can apply to become service connected for a disability or medical condition that they may have developed in their time of service. So as you can see on the slide, it can go from anywhere from being non-service connected to 100% service connected. And in addition to determining how, what they have to pay for our services, if they are service connected, they also receive compensation from the VA. So throughout the presentation, I'm going to give some examples of services that are dependent on if a veteran is service connected or not. There's actually a designation that is 0%, which is kind of confusing, but really what that's acknowledging is that a veteran does have this condition related to their time of service, but at this point in time, we can't or we don't attribute them to have any kind of negative impacts in their day-to-day life from that disability. So a common question I ask veterans if they aren't service connected is, do you have a disability or medical condition related to your time of service? And if they say yes, then we're really going to want to get them connected to a veteran service officer so they can work on filing a claim. So just for your reference, here are a list of common service-connected conditions. And so you can see that there's a whole host of conditions, and then a lot of times the most common we're seeing is hearing loss. So a lot of veterans, especially older folks, when we didn't have proper hearing protection, do have hearing loss related to their time of service. So there's another component of accessing care at the VA, and that is something called a priority group. So a veteran goes ahead, gets enrolled in our system, we look at their income, we look if they're service connected or not, and based off of that, we assign them a priority group. As you can see, these are the factors we take into consideration. The importance of a priority group is it determines if they owe copays for services and their eligibility for what care they can receive at the VA. And so this chart is from 2018. The only rates that have changed a little bit are these inpatient care rates. And so as you can see, we lay it out by priority group and then if they're owing copays for services. So a veteran who's enrolled in priority group 1, so service connected or 50% or higher, received Medal of Honor, they're not paying copays for any services here. I'm going to go into depth about what services a veteran would owe copays for, but I'd just like to highlight that there are a lot of different groups and factors that go into determining what a veteran pays for in our healthcare system. So to break down copays, it's really pretty cool what we can offer at low to no cost for veterans. And I also like to highlight that a lot of times veterans also are coming into our healthcare system utilizing other insurance, and then a lot of our older folks also have Medicare. So any visit related to primary care, if they do owe copays, is $15. What's really cool about our primary care services is they don't just see a doctor. We also have a clinical pharmacist. We have psychologists and social workers that do what's called primary care mental health integration. We have dietitians, other mental health support, and then every primary care provider also has a social worker assigned to them. And so that is what we call the patient-aligned care team model. So if a veteran owed copays, they would pay $15 to see any of those disciplines. Specialty care, most common what we're seeing with veterans is like visiting audiology. So audiology, if they owed copays, would be $50. And then we do have copays for inpatient services depending on the priority group. Medications, veterans who do owe copays for medications pay anywhere from $5 to $11 for a 30-day supply. What's really cool about that is I'm sure a lot of you in the community know how expensive some medications are, like heart medications, insulin. So that is covered at the VA. And again, the max they're ever going to pay is $11 for a 30-day supply. In the past couple of years, the VA expanded what we call community care, so services a veteran can receive in the community, and that now includes urgent care. So a veteran can go to an in-network urgent care, and the copay for that is normally $0 for the first 3 visits and then $30 after that. And then I like to make the distinction for folks, especially working in a hospital setting. We often hear the term Tri-West, and then we hear Tri-Care. And it's sort of like Medicaid and Medicare. They sound so similar that it's easy to get them confused. So Tri-West is not insurance. It's actually the party that handles our community care billing. So they are who authorize veterans visits in the community and that they pay for it. And so sometimes a hospital will call me and they'll say, well, the veteran has Tri-West insurance. And that is not the case. So TriWest might have authorized that hospital stay, but it's not an insurance benefit. TRICARE, on the other hand, is a great insurance that's offered to service members, people who've retired from the military, their spouses. And so that is a pretty comprehensive, basically commercial insurance policy that veterans can also have. So I'd like to cover some slang that you might hear thrown around at the VA when you're interacting with social workers or other staff. We have quite a few forms that we use and that they can be pretty confusing. So I'd just like to cover a couple of them. So the 1010EZ is what the veterans fill out when they go to enrollment and eligibility. The 1010EZR is something we refer to as the means test. And typically we have veterans update their means test every year depending on their service connection. And that's really important because veterans, we don't want them paying for things they don't have to be, and we don't want the IRS coming back and saying it looks like you haven't updated your income with us in so long that you're going to owe for all of these services. So we might ask you as a community provider to help us get that filled out. The 1010EC helps people apply for extended care services and determine if they have copays, and I'll go a little bit more in depth in the next coming slides about what we offer for extended care services. And then the 101204 is something that we ask providers to fill out if they're helping us refer a veteran to one of our contract nursing homes. So I'm just going to keep going here. So we have a pretty robust program of geriatric and extended care services. And I used to work in the community in home health and primary care. And it's just crazy how many more services we can provide at the VA for veterans at low to no cost than that is available in the community. So one thing veterans take advantage of is skilled and unskilled home health. So unlike Medicare that has a set number of visits that are authorized, if a veteran meets certain criteria, they can have unskilled and skilled home health care coming into the home over a long period of time. So we have veterans who have been receiving CNA services or skilled nursing for medication management for years. So as long as they continue to meet that criteria, they'll be able to receive those benefits. We do offer adult day health care for folks with cognitive impairment or wanting more socialization. Often it provides respite to caregivers. That's been a little bit on hold with COVID, but we do offer that. We also help veterans get enrolled in the PACE program, which in the Denver metro area is end of age. So a veteran that's 70% service connected or higher can utilize PACE, or we work with veterans who are eligible for Medicaid. And then on the, just looking at my screen, so respite is another good benefit. We offer in-home respite or institutional respite at one of our contract nursing homes. You can mix and match that benefit, and you get a total of 30 days per calendar year. And then on the right-hand side are just some other services. So we offer medical foster home, which is a veteran getting to stay in a private caregiver's home. They do privately pay for that service, but it's a good alternative to a nursing home. We have our nursing home benefits, home-based primary care, and then veteran-directed care, which is a paid caregiver program. And then we offer geriatric primary care services. So it is important for a veteran to get established with a primary care doctor to access a lot of these services. There are exceptions if a veteran's home with hospice and we just really need to quickly get services in the home. But we really want a veteran to meet with a provider every year to every 6 months to make sure they can still access services. They don't have to give up their primary care provider in the community unless they enroll in our home-based primary care. And so oftentimes the first step after getting enrolled in our healthcare system, we want them to schedule with a primary care provider. We also like to highlight that we have a really robust telehealth program and can offer on-demand video appointments or scheduled video appointments. We also recognize that there are a lot of inequities that lead to people not being able to access video appointments. So we call that a digital divide, and we work as social workers to identify if a veteran could benefit from getting a VA-issued tablet to go ahead and offer them video visits. And those tablets come with enabled cell service so that they don't even have to have Wi-Fi. So as far as looking at long-term care benefits goes, I do like to cover what we do offer veterans and what we do not offer veterans. So a big benefit that's really cool that we can offer is long-term care at one of our contract nursing homes. And so a veteran needs to be 70% service connected or higher, or there's some other exceptions to that. Here at the VA, we kind of always have an exception to everything. But if they meet this criteria, then they do qualify to go to one of our contract nursing homes. We also offer something that I find really cool. If a veteran meets hospice criteria, we call it our end-of-life benefit, and regardless of their service connection, they can go to one of our contract nursing homes with hospice benefits. There are state veterans homes that are not operated through the VA. They're actually regulated through the state of Colorado. And a veteran either needs to be 70% service connected or higher, or private pay. A common misconception is that we pay for assisted living or independent living, and unfortunately that's just not something we can offer. And then we don't offer long-term care benefits for spouses. There's really the limited amount of services we can have for spouses. One is aid and attendance, but that would go through a VSO. Sorry, just let me see how I can get to the next slide now. Okay, so quickly just going over our two our caregiver programs. We do have the veteran-directed care program that a veteran could choose a caregiver to provide care that they need and get paid for it. Our caregiver support program has also recently expanded for veterans who are 70% service connected or higher. Both of these programs have ADL requirements, so the veteran does need to have assistance with ADL, or for our caregiver program, they need to have the need for supervision for safety and protection purposes. So that would be a veteran who has severe cognitive impairment and can't be left alone, or maybe the veteran has a severe mental health diagnosis that due to severe suicidal ideation, self-harming behaviors, things like that, needs a caregiver with them at all times. A couple other monetary benefits are something called aid and attendance, which is additional money every month a veteran can use to pay for care that they need. I won't go into the specifics with this benefit, but I am happy to talk offline about what the requirements are. We also offer housebound benefits and something called a non-service connected pension for low-income veterans who served during a wartime period. So just kind of buzzwords to keep in mind as you work with veterans. A couple other things I quickly want to highlight is any type of durable medical equipment is covered by the VA, and so veterans do not have to go out and buy any of that, and this is including like motorized wheelchairs and really kind of expensive items. We also offer a home modification grant for both service-connected and non-service-connected veterans that they go through our occupational therapy department to work on that. A few other benefits. Audiology is something every veteran's entitled to. The max they're going to pay for hearing aids is that $50 copay. Veterans can get an eye exam every year. Dental benefits are very limited. And then I like to highlight that things like Insure and Boost can be covered and ordered by the VA for your veterans who need nutritional supplements. Any kind of burial benefits or spousal benefits need to go through a veteran service officer because they're kind of the experts, but there are some options out there. So Bryan, I will let you take it away into our mental health services.
All right, thank you, Beth. So yes, I just wanted to spend a little bit of time right now talking about both the model and approach to mental health that we have here in the VA, and then speak a little bit to some of the programs that we offer. And again, feel free if anybody has any questions to put that in the chat. As you can see here with this slide, our mental health services here is really on a continuum where at the very top would be like the highest level of care, so inpatient, residential treatment, specialty mental health programs, general mental health. Underneath that is primary care or primary care mental health integration, which are mental health providers that are embedded within primary care teams. And then at the very bottom there is self-directed care, where a veteran is able to practice their own coping skills, strategies to maintain their wellness on their own and through the support of their friends and the family and the communities that they live in. And as you can see, there's a veteran may have sort of different needs at different points in time. They may kind of go up and back down or up and back down as far as this continuum of care. Let's go ahead and go to the next slide. All right, so there's a lot of information here on this slide, but I did want folks just to have a little bit of familiarity with the model of mental health care that's used throughout the VA system, which is the recovery model of mental health. Some people, when they hear recovery, they may think of that as regarding like substance or addiction recovery, and that's oftentimes what people think of. But really in this case, what we are referring to is really a broader definition of recovery, meaning a person's journey in order to work towards achieving a life that is meaningful and purposeful. And upon achieving that is really where happiness can come from at that point. One thing to keep in mind is that in VA, the ultimate goal of mental health services is really that progression towards recovery. A veteran who enters into, let's say, comes into our system, if they do not have a recovery goal in mind, they're not interested in something like that, then we're probably going to try to see if there's maybe a better option that might better suit their needs. So really it is part of our model that the folks who are in our system are here because they do have an interest in working on their recovery, and then we're here to partner with them collaboratively to work towards that. Some of the components you can see with our model, so at the sort of top right there, person-driven, meaning that we really do take a veteran-centered approach to care. When a veteran comes into care, part of their treatment planning process is they're asked, what do you identify as a problem or problems in your life? It's not the staff member saying what I think your problem is. It's the veteran coming to us and saying, here's what I see the problems that are going on. And sometimes that might be also if the veteran is entering care with their significant other or friend, they may also be able to come with them and speak to that as well. Many pathways, meaning that we do understand that the recovery journey is not a straightforward linear process necessarily. It's not common that a person comes in, gets the exact kind of treatment they need, and then they're cured for life, and they are always in a state of maximal recovery. That's just not reality. We know that unexpected things can happen. Stress of life, stress of the pandemic, symptoms that flare up for no apparent reason. Sometimes a medication just stops seeming to work so well. There's all sorts of different reasons. A person might have a relapse on substances out of the blue. So we recognize that does happen. We're not here to judge somebody if they slide back on their recovery process. We're here to continue to help them and understand that is part of the process and that things are nonlinear and those ups and downs do happen. As far as holistic, so that is another thing about VA mental health services is, yes, we do have lots of well-trained, licensed clinicians who are very well trained in providing those clinical services. We also recognize that a lot of veterans may utilize traditional mental health clinical services as only one component of their overall wellness and recovery process. So, for example, a veteran might benefit from both, say, psychotherapy and medications, but they may also benefit from things like working on their whole health, getting connected with one of our chaplains, recreation therapy, things like that. So we do take a holistic approach to care, and we realize that for most veterans, there's a multitude of things that really helps them, and not strictly just clinical services. So we do partner a lot with those other services and bring that into the clinical services that they receive. As far as peers and allies, another thing we recognize is that for many veterans, they benefit not just from trained professionals, but also people who they see as being like them. So some veterans may prefer to talk to someone who's also a veteran, who's been there, and also somebody who has their own lived experience in recovery. So I'm happy to say that here in the VA Eastern Colorado, we currently have, depending upon vacancies, but we have at any point up to 18 dedicated full-time staff who are VA veteran peer specialists. So we have peer specialists really embedded in different programs pretty well all throughout our mental health service. So that's something also to be aware of, to speak to veterans who may be coming to you or your organization, to let them know if they would want to get all out of their support through a fellow veteran, that is very likely an option for them. And they work collaboratively as part of those interdisciplinary care teams. Below that, relational, recognizing that for the most part, veterans, they're not living in an isolated bubble. And the mental health services that they receive do recognize that and understand that it's not just the therapist or psychiatrist and the veteran. The veteran lives in a community. They have loved ones. Those relationships can be very valuable and important for their well-being. At the bottom there, cultural. So we do employ quite a few veterans who are in our mental health service, who are going to have a lot of firsthand experience, being in the military and understanding military culture. But that's something that for staff who are not veterans, receiving training on military culture, and also just being a culturally informed practitioner is very important as well. Understanding that veterans are a very diverse group, and recognizing that that can also be very pertinent to their care, and tailoring the care to the culture and background that they come from. Over there to the left addresses trauma. So we do take a trauma-informed approach to care, recognizing that whether it's prior to the military, during the military, or after the military, many veterans have, at one or more points in time, experienced traumatic events, and that can impact their mental health and wellness in many different ways. And then we are, as mental health staff, keeping that into perspective. So, for example, in some cases it may not be the identified problem necessarily. Maybe a veteran is coming in related to a substance use disorder. But if they have a background where they've been exposed to trauma, that could certainly have an impact on their using. And so for the staff, being mindful of that. Strengths and responsibilities. This is another approach in VA mental health care, is that we do take a strength-based approach, recognizing that when a person comes into mental health care, it's because they are having problems and maybe their life has gone awry and things are not good. But we on our end as staff really want to emphasize the strengths and resources and how they are resilient, and really keeping that part of the focus. With respect, being respectful in our approach based on how people want to be referred to, using recovery-oriented language, and then also making sure that that we are respecting patients' rights and recognition that they can consent or not consent to different kinds of treatments that are offered to them, and then follow what preferences that they have. And then last at the top, hope. And so that's something that we as staff really want to maintain, that fundamental belief that we believe that people do have the capacity to recover, even if they're experiencing ups and downs and things are not going well in their life, that we do believe that that through their own internal strengths and resources and the support that we can provide, that they will continue to be able to bounce back and continue to work on their recovery. Next slide. So speaking a little bit more about our continuum of care, at the very far left side there, what you see is primary care mental health integration. So this is usually the starting point of where people come into care, unless it's an emergency, and then they may come in through the inpatient unit if it's a crisis. But for the most part, if a veteran is having some mental health challenges, they may start by talking with their primary care provider about that. Also, primary care providers routinely do assess for mental health symptoms, and so in some cases, a veteran with mental health needs is first identified in primary care. Each primary care team has mental health providers embedded within that team, and so that primary care team can do a warm handoff to that embedded mental health provider to further assess and understand, what is going on. Oftentimes, what's needed is really just sort of a short-term service, and that may be really all they need, and then they're kind of good to go at that point, and then they can always come back later on if, say, they have a resurgence of that issue. If a person may need more intensive care, maybe more long-term care, then that would take them up to the next step, which is general outpatient. So we do have general outpatient mental health offered throughout our entire system at all different sites for more ongoing mental health treatment. One thing to kind of keep in mind with general outpatient clinic is that treatment as well is really moving more and more towards an episode of care model, practicing evidence-based approaches to care, where a person, may get longer-term treatment, but really it's going to be focused on a goal, treatment provided to help improve that condition and help them work on their recovery, and then at that point transition them back to primary care or primary care mental health integration if they were to need to return back into care at that point. Also note that we do have, sort of down there at that last bullet there, homeless services. We have homeless services, a very wide range of different kinds of homeless services available, and I'll speak a little bit more to that on the next slide. For specialty mental health, we have a multitude of different kinds of clinics and programs for specific needs where it's a more kind of targeted approach to care based on a certain condition or need. So like if a veteran has PTSD, and really is wanting to dig into that and get a real focused treatment on that, then that's something that they can get. Substance use disorder treatment, we have a specific clinic dedicated to that. Veterans with a serious mental illness, we have 2 different programs, really 3, on that population, and so on and so forth. We also have many health psychologists. So in many cases, a veteran with a medical condition, there is very likely a mental health provider embedded within that specialty medical team, given that we know that in some cases the condition can affect their mental health, or their mental health can affect their condition, and so on and so forth. And so that's why we do have mental health providers embedded within a lot of the specialty medical teams. As far as residential treatment, we do have Valor Point, which is located in Lakewood. It is a domiciliary for homeless veterans needing more support and a little more time to kind of get their housing situated. That recently combined with our PTSD residential treatment program. However, the PTSD residential treatment program has been kind of on a admissions hold for the time being. They are going to be building a new building at the main campus in Aurora that's due to open in probably about a year or 2 years. And then at the top here of the continuum of care, as you can see, is our inpatient psychiatry unit. So if a veteran is in a mental health crisis or risk of harm to self or others, then they would, they would be able to be admitted to our unit, or if the unit's full, then they can be, diverted out to a community non-VA facility that the VA would be able to cover if we have to send them out because we're full. And really, primarily for admissions to our inpatient psychiatry unit, that's handled by going through our emergency department at the main campus in Aurora, and then being able to be admitted directly to the unit from there. Or in many cases, veterans just go to the nearest ER based on where they live. And if that happens, say a veteran is in Colorado Springs, they go to their local emergency department. They can just make sure that somebody there knows that they are a veteran, that they're enrolled in the VA, and then that provider there in the ER can contact us at the main hospital and see about initiating a transfer if that's possible. Okay, next slide. All right. I also just wanted to, looks like you can't quite click these links here since it's on the slide, but I'll go ahead and put these 2 links in the chat. What you see here on that graphic on the left is a breakdown of our different many programs. This is a downloadable guide. You can, it's free for distribution, so you can certainly, print it off or forward that link to other folks. As you can see, there's a breakdown between, we've got urgent and crisis support, our various mental health treatment programs, including both general outpatient mental health and specialty mental health clinics, health psychology, and then support for veterans with their homelessness and or justice involvement. And then real quick, as far as our homeless programs, I'm not going into all the detail because there are quite a few, but really the 2 main intake points for homelessness is our Healthcare for Homeless Veterans Clinic, which is at the main hospital in Aurora, or we have a community resource and referral center, which is in Denver on York Street. There's also the Homeless Veterans Hotline. So that number, if you call that, then one of the staff that work in those programs will provide a follow-up call, find out what's going on, and then be able to take things from there. After being evaluated at one of these intake locations, they'll be able to tell the veteran, after doing an assessment, what kinds of homeless services that they would likely be eligible for, and then they can further pursue that from there based on whatever they might be interested in. And then a Community Mental Health Provider Toolkit, that is a good resource for those who may be serving veterans in their organization but want to get a little more information about providing care to veterans and a little bit more about providing connecting with VA mental health services. And then definitely, like I mentioned at the introductions, I'm available for If you want to reach out to me, I'll put my email and phone number in the chat if you have any questions or trying to better assist veterans with navigating our services. And then feel free to let me know if you have any questions via chat.
So Bryan, I was following the chat here a little bit, and Bethany as well for you. There were some questions. Did you just want to take the opportunity now to answer before we move on?
Suzanne, I think we should just keep going and then take them at the end.
Very good. Okay.
Thanks.
Fantastic. No problem. Okay, so you've heard a lot right now. I'm going to see if I can start my video. We've been, I'm hopeful here, maybe. You've heard a lot of great information about mental health and how to access care through the VA. What I want to share with you a little bit today right now is talking about how you can connect with other resources that is outside of the umbrella termed or coined VA. We have the VCP, the Veterans Community Partnership Program, and in the VCP, it is established to be able to help our veterans navigate the needs that they have. Just as we've heard today, medical needs, physical needs, whatever that might look like. Bethany has talked about the VSOs being a source for assistance. The VSO is also a great connector with the Veterans Community Partnership. VCP was established to help patients over age 65 as they navigate technology and the VA system. How do we do that? How do we do this? How do we best serve our veterans in our community? It's by connecting them with resources, whether it is directly through the VA or it is community partners such as yourself, and making sure that the veterans are taken care of based off of their need and the services that you provide. Next slide, please. So how we do this is a couple of ways. Courtney Bowers is our Veteran Community Partnership Chair. And if you are interested in joining our VCP program, I ask that you reach out directly to her. Her email is listed here, courtney.bowers@va.gov. She will send out information, newsletters, articles, connections such as this one, in ways that you can learn more about how to connect with the community. Additionally, we have the Access to Care Rounds, which is what we're experiencing today. Our next one will be in February. I apologize for the information there. The next one will be February 5th. And we hope that you can join us for that virtual event. I will put that information in the chat bar so you have access to that information. Oh, I see. The next one will be in January. It's in red. So just make note to the information in red. And we look forward to continuing the conversation and learning how we can connect with connect you and our veterans to make the effort and take care of them the best that we possibly can. Community partners are really important for us so that we can help disperse the level of care in a way that the VA certainly has its unique parameters that they will help a veteran with, but then community partners step up, nonprofit agencies, they'll step up and support in ways that they can. For example, we have nonprofits who can help veterans who need wheelchair access. So they can come out to the homes, they can help establish the ramp to get the veteran up into their home via a wheelchair ramp. We can also make a home accessible for wheelchairs. So these are just some small examples of ways that you can connect with community partners who join the effort with the VA and the Veteran Community Partnership Program. Next slide. So how do you do this? Like, what is the best way to connect with the Veteran Community Partnership? As I had mentioned, you're going to reach out to Courtney Bowers, and I know she put her information in the chat bar earlier, but I will go ahead and put that in here in just a second. you're going to connect with Courtney, and from there we can grow and establish that relationship. Veteran situations who we have provided assistance, chronic pain, homelessness, suicide, this is not inclusive, but these are just some examples as to how we have helped our veterans, and we have worked with our community partners, to take care of those needs. Ultimately, we want to continue to see the VCP program grow. We want to see the success of the program, be fruitful for not just the veterans themselves, but for us as partners. It's always nice. Sometimes you hear the term, it's not who you know, it's not what you know, it's who you know. And this is very much the case here and would be true. It's important to know those in the community that can help as needs arise. So our goal is to improve how the VA connects with our community partners in ways to help with mental health and other miscellaneous needs. Next slide. So here are some important phone numbers as we talk about community resources. Here are some important phone numbers for you to take note of. I did see a couple of notes here in the chat bar asking for copies of the slides. Take a screenshot of this if you would like, but we will make sure we get the slides pushed out as well. We have the Veterans Crisis Line here for you, the homeless hotline, the VA benefits, etc. So please take advantage of these phone numbers. They're there for you. I know it's not easy at times navigating the VA, but the professionals on this call, in addition to those that are located through these phone numbers, will do their very best to provide you the assistance that you need. Next slide.
Just real quick, Suzanne, I wanted to highlight this emergency notification line. So as a community provider, it's a good number to be aware of. If a veteran goes to a hospital for an ER visit or a hospital admission, we need to be notified within 72 hours for it to be considered for payment. And so this is really important, especially for our uninsured folks, but I just wanted to make sure that was highlighted.
Very good, thank you. Okay, and so here are some VSOs. The VSOs are located throughout the state of Colorado, so if you have a veteran who has a need, please feel free to look up your local VSO. We have highlighted a few here for you at your convenience. In addition, some other excellent resources who we have partnered with who really put forward a good effort to support our veterans. So these are, just wanted to share a few of these with you as well. Next, some of which you guys are probably already familiar with, VFW, American Legion. All of these are common in the community, so it's important for you to have that information. The JCF Resource Guide, Joining Community Forces. This is the 2021 guide was published, and in it you can find a full list of all VSOs in the state of Colorado, and you can find that guide on the web portal coloradojcf.org, and we'll show you that information here in just a second. Next slide. Did my computer, can you guys still hear me?
Yes, Suzanne, we just wrapped up to the last slide with our contact information.
Okay, great. Great, thank you. So yes, here's our contact information, so please don't hesitate to reach out to us in the event that you have any questions, concerns, or needs. Any one of us would be happy to help you, help navigate through the system with any needs that you have. I am so sorry, Bethany. Is the JCF resource listed on that as well? My computer froze.
Yes. Well, we have our main website for people to take a look at, and then Courtney's contact information.
Okay, great. Yep. So if you are interested in being a part of the Veterans Community Partnership Program, please do not hesitate to reach out to Courtney. She will add you immediately, welcome you aboard, and from there you'll start receiving all of the information as prescribed by VCP. And again, Joining Community Forces is coloradojcf.org. On that website and on that portal, you'll be able to obtain multiple resources, all of which are nonprofit agencies, and just some real helpful information as you and your veterans navigate through the system, through their need. I apologize. And at this time, that's all that I have. If we would like to open it up for questions.
Thanks, Suzanne. I also just wanted to highlight quickly, so if you are a community provider and want to determine who the social worker is, who's assigned to the veteran you're working with, please call these. We have our main number or our toll-free number. You'll talk to someone in our call center, and they'll make sure a message gets to the appropriate provider who will follow up with you. Just looking at the chat box, I'm not sure if the folks who asked some questions are still on, but Tanya, you asked about if a humanitarian veteran can get glasses, and unfortunately that would not be a covered benefit for them. I think I'm so happy to see everyone who wants the slides. We will be sending those out as well as some helpful handouts, and we definitely want to add you to our mailing list. There's some questions about art therapy. I think we can get back to you directly on that if you want to put your email in the chat box. Or do you have a comment for that?
Yes, so the rec therapy department here does have, actually I just got an email about this, they do have a craft kit group that's happening through VA Video Connect, which is our telehealth app, or you can do it on a computer or tablet. So that is something that a referral can be done from the primary care provider to the recreation therapy department to get plugged in with that craft kit group. And I do believe that what they're doing is we're probably having to mail out those craft kits to the veterans, and then everybody's doing them on the VBC together. But if anybody has any further questions about that, feel free to reach back out to me on that.
Yeah, that's a great resource that's out there for sure. Any other questions folks want to put in the chat box? Well, we thank you so much for having us today. I'm so glad to see such a good turnout. Please reach out if you have any questions, and we look forward to seeing you at future events. So thank you so much.
Thanks for being here.